My name is Victoria Lopez-Phillip. I'm originally a social worker in the emergency room here at Jacobi, but I've been covering inpatient medicine. So in the emergency room, we tend to have faster paced cases, right? Cases that you kind of can wrap up and be done with. Inpatient medicine tends to be a little bit more different. People kind of have higher needs and their level of care requires a longer stay than someone that would come to the emergency room. So that's the difference between those two. Like a lot of our, colleagues here, we have all experienced, a lot of our patients are not making it. With that comes the relatives and their inability to really have that closure upon their loved one dying because they can't be with them. So I think that even though we lose the patient, we can still be there for those family members and kind of help them through the process even after, the patient is no longer with us. I think that it's been really hard because we have to be present for our patients here. And for me in particular, I tend to just function on automatic pilot. I come, I do what I have to do, but I really try to stick to my normal routine of making sure that when I leave here, I go home, I spend time with my family, I cook dinner. If I have to hit the yard and do some gardening, I do that. Anything that's going to kind of decrease the anxiety of this and the stress of the day. I think that the presence of the soldiers have really impacted us in a positive way. I mean, just seeing you guys, for me, has been like, oh, wow, they're here and they're here to help us. And everyone's been so kind. And even from giving us, a little bowl of food to, helping out with I see them helping take materials around the hospital. It has really been, an amazing experience.